Thinking spine surgery will fix all your back problem? I tell you, it is not that simple. Surgery can be great for nerve impingement, but for many other things, you need to think twice about having it. When back pain is overwhelming, disturbing your life, draining your energy, and you are desperate, you may take any treatment offered to you, including surgery. Spine surgery is a good option for mechanical things like nerve impingement, spinal instability, severe spinal deformities like scoliosis or hunchback. For example, if a slip disc is pressing on a nerve, surgery can remove that pressure and significantly reduce the sciatic pain. If the spine is unstable, fusion surgery can restore the stability. But surgery should not be done just because your back pain doesn't get better. If your pain is from muscle strain, arthritis, or disc bulges without nerve compression, surgery won't help. In short, don't rush into spine surgery unless the problem is well defined and non-surgical treatment has been tried. Here are 5 spinal conditions where surgery is usually not the right treatment. Acute back muscle strain is one of the commonest causes of back pain. The pain is usually localized over the muscle and usually triggered by lifting heavy things, twisting, and sudden back movement. While the pain can be severe, most people recover within days to weeks with just rest, gentle stretching, and physical therapy. Surgery won't fix this type of back pain. In fact, it is unnecessary and could even make things worse. So, conservative treatment is almost the best and the safest option. Annular tear is a small rift in the outer layer of the spinal disc. The back pain occurs suddenly and it can be severe. Most annular tears heal on their own over weeks to months. The treatment focuses on rest, physical therapy, anti-inflammatory medication. Surgery is not recommended for this type of problem. Actually, there is nothing to operate in annular tear. Again, this condition should be treated conservatively, and similarly, a black disc or disc bulges without nerve compression should also be managed non-surgically. Facet joint arthritis is gradual degeneration of small joints in the spine. The back pain is usually localized just off midline over the facet joints. The pain often worsens when bending backward and sometimes causing stiffness. The condition typically progresses slowly and treatment focuses on physical therapy, anti-inflammatory medication, activity modifications, and occasionally targeted spinal injection. Surgery is generally not recommended unless there is nerve impingement. So conservative treatment is the most effective approach for this kind of condition. Chronic low back pain is persistent pain in the lower back lasting more than 2 to 3 months. Dull aching pain with stiffness is there most of the time with intermittent flare-ups without a clear cause. The pain can fluctuate. Someday it interferes with daily activities, and the treatment is again conservative, physical therapy, exercise, pain management, lifestyle modification, and occasionally spinal injection. Surgery is not the best option, and it rarely improves the symptoms, and sometimes it can make the pain worse. Mild scoliosis, a sideways curvature of the spine, is often discovered incidentally, usually not giving problem, so no surgery. while bone spurs are signs of spinal wear and tear. Both conditions may not cause back pain and often only lead to mild stiffness. And sometimes there is no symptoms at all. If you have back pain, it is often unrelated to the mild scoliosis or bone spurs. The treatment focuses on exercise, physical therapy, pain relief, and regular monitoring. Surgery is not necessary. So it is not necessary to remove the bone spur unless it is impinging the nerve. Also, surgery is not necessary for mild scoliosis. Spine surgery can be life-changing when it is done with the correct indication and when it is truly needed. But not every back pain needs an operation. Most common spine problems respond well with conservative treatment. So know your diagnosis and explore non-surgical options first and make informed decisions. Surgery isn't always the answer. If you are suffering from back pain and you are desperate, you need to understand what I said in this video. I believe this information is useful. Help me to like, subscribe, and share. Thank you for watching and see you again next time. Bye-bye.